Hello, my name is Brandon Mako, and today I'd like to talk about proton pump inhibitors. So, proton pump inhibitors are a class of drugs, and these are prescribed to people with acid reflux. Acid reflux, sometimes diagnosed as gastrointestinal reflux disease, is when the sphincter that holds the acid in your stomach down is behaving in a faulty manner, basically allowing the acid to go up into your esophagus, which can burn your esophagus because it's acid. It can eventually, it can destroy the lining of your esophagus, and there's nerves there and neurons there that help to control the sphincter itself. So eventually, if you destroy enough of your esophagus, the sphincter stops working basically entirely. So you get more and more of this gastrointestinal reflux, and you basically can't stop it. There is surgical intervention at that point. But also, all this burning of the esophagus can lead to Barrett's esophagus, can lead to basically cancer of the esophagus. So it could eventually kill you. So there's a reason why a doctor will want to prescribe drugs to help someone with acid reflux, because the consequences of acid reflux can be quite severe. That being said, proton pump inhibitors like Prilosec and omeprazole, and there's a whole class of them, they are for short-term use only. They basically prevent your stomach from producing hydrogen ions, basically acid. And so your stomach will have less acid. So if your stomach is producing less acid, yes, it will burn less, but that's not curative. That doesn't solve the sphincter problem. That just means it burns less. But if your stomach is producing less acid, it doesn't digest your food properly. And so you can get gas, indigestion, other sort of stomach pains and problems. This is assuming if they have their diagnosis right. I have another video where I talked about that NSAIDs like ibuprofen and Advil can cause stomach pains. And so a lot of people who are diagnosed, in fact, I think it's at least a quarter of people who chronically use NSAIDs were found that they were also given a medical diagnosis of GERD and were prescribed GERD medication like proton pump inhibitors, even though that's the wrong diagnosis because their stomach pain is not caused from acid reflux, it's caused by ulcers caused by their NSAIDs. Sorry about that aside. Back to the proton pump inhibitors. So it weakens your stomach acid, prevents you from digesting your food properly. It does prevent some of that burning in your esophagus because the acid is weaker, but it's more symptom relief rather than curative. What's supposed to happen, because this is for short-term use only, what's supposed to happen is you're supposed to get a prescription for the proton pump inhibitor, and then the doctor is supposed to sit you down and, okay, let's figure out what we can do, what we can change about your life and your diet so you don't get this acid reflux anymore. And this crusade against proton pump inhibitors, I've taken it up, but my pharmacology instructor, that was her crusade. She's a doctorate in pharmacology, and she's like, no one reads the label, it's short-term use only. And it's true. Basically, every elderly person I've ever treated, I ask them about their medications, and oh my gosh, almost every single one is on a proton pump inhibitor, basically for life. They've complained once in their life about having some indigestion, and they get on a proton pump inhibitor. And maybe their continuing indigestion is because of the proton pump inhibitor, who knows? But it's not for long-term use because you can't digest your food properly. So what are the recommendations? What are some of the recommendations that you should get from your doctor if you've been diagnosed with GERD? Assuming GERD is the correct diagnosis. Assuming the sphincter works okay and it hasn't been burnt entirely and the sphincter still works a little bit. If it doesn't work at all, there are some surgeries. There's also cases where the stomach actually comes up basically through the diaphragm, and you might need some surgical intervention there. There's some osteopaths and some chiropractors who will try organ manipulation, trying to pull the stomach down, basically place it in a different place. Not sure about the success rate with something like that, but there's things to try there. Okay, lifestyle changes. First off, if your stomach isn't overflowingly full, that helps. So typical Americans just overindulge and overeat. Your stomach is much smaller than you think. So think of your stomach maybe about the size of your fist. You shouldn't consume more food than the size of your fist in a sitting. That's a good rule of thumb. And if you think about that, you're like, I normally eat that much. Like a lot of people eat a lot more than that in a sitting. So if you're getting GERD, what you should do is you should break your meals into that size of food, eat it, and if you're still hungry, wait 15 minutes, wait 20 minutes, maybe wait 30 minutes, wait until your stomach is completely empty, because your food doesn't stay in your stomach for very long until it's pushed into the small intestine to continue the digestive process. So it will start emptying sooner than you think. So you might only have to wait 20 minutes, 30 minutes before you can have another bowl of food if you're still hungry. Actually, that sort of tidbit of taking a break within your meal can actually help you also if you struggle with weight gain or losing weight. Um, Taking that break in the middle of a meal can help you figure out how hungry you are. Because a lot of people just eat until everything on their plate is gone. They eat until they physically can't stuff more in, instead of eating until they're not hungry anymore. And it takes time for your body to figure out whether it's still hungry or not, whether it wants more or not. So if you take that break, it can be like, am I still hungry or not? You'd surprise yourself. Maybe I'll be like, you know what? I'm not hungry. Or maybe, I was going to have like 3 fist sizes worth of food. You know what? Maybe I'll just have one, or maybe half of one. So it can change people's eating habits and quantities of food, which can greatly help um, with weight loss or weight control without actually affecting people's diet, because you're still eating until you're not hungry anymore. So you're not suffering and you're not changing what you're eating. So sorry again for that aside, but a lot of people with GERD also suffer with maybe a little bit too much weight, or they are in the process of also trying to lose weight. So that little tidbit might help them. Okay, so the advice, limit how much you eat in a sitting, basically. The other thing is don't lie down right after eating. So sit fairly upright. You can recline a little bit, but you want to use gravity to help hold that acid into your stomach. You don't want to lie down, because then everything relies on that sphincter keeping the acid down. So you just want to give your body the best chance at holding that acid down itself. The other thing is foods. Some foods seem to affect people's GERD more than others. I'm not going to get into that here, but you can experiment basically with your diet and what foods seems to aggravate you the most, and just eat less of that. Or again, you could cut it out entirely, but it's possible that you just need to eat less of that type of food, and that might resolve your GERD symptoms without having to rely on proton pump inhibitors your whole life. So I hope you found this informative. I hope this helps some people. I wish you all the best. Good luck. Cheers.